Hello, I'm Dilip Naran. Thank you for the opportunity to present to you today. I'm going to be talking to you about electronic patient record solutions. In this talk, we will be looking at the principles of good record keeping and tying that into the use of electronic patient record solutions, and more importantly, how one should go about starting to use an electronic patient record solution. We'll be looking at good record keeping, and then electronic health records. What are the drivers and barriers for these? What are the benefits and criteria for choosing an electronic health record? I'll include my best practice approach to actually adopting an electronic health record as well. So for those of you privileged to be practicing the art of medicine, most of what you do today is due to the work of Hippocrates. It's generally accepted as the father of clinical medicine. Hippocratic medicine was notable for its strict professionalism, discipline, and rigorous practice. And Hippocrates was known for the careful, methodical, and exact notes he made of history and symptoms, even delving into family history and the relevant environmental factors. Hippocrates was so highly regarded by his peers that his teachings were largely taken as too great to be improved upon, and no major improvements of his methodologies were made for a long time. However, medicine is all about improvement and advancement, coupled with a passion and a will to do things better than previously the case. So if Hippocrates was the first to see the value of good clinical notes, Dr. Lawrence Weed was a pioneer in trying to standardize clinical notes when in 1964 he developed the SOAP format, which stands for Subjective, Objective, Assessment and Plan. This was a structured system for the clinical evaluation of the patient. It facilitated a comprehensive analysis of clinical problems and the development of differential diagnoses that would culminate in an effective treatment plan. This allowed emphasis on the patient's clinical problem rather than diagnosis. SOAP notes have been taught to generations of young doctors and form part of the patient-oriented medical records that are widely used by most doctors today, keeping contemporary handwritten records. So let's look at why keeping records is important. It's a basis for historical record. It enables communication between providers and anticipates future health problems. It allows for recording standard preventative measures and identify deviations from the expected. More so, it is a legal record and it's the basis for clinical research. The types of clinical data that is usually kept in a medical record includes numerical measurements, recorded signals such as ECGs or EEGs, images, which includes X-rays, MRIs, and CAT scans, ultrasound, pathology, and then coded or discrete data. This includes family history, patient's medical history, current complaint, the physical examination, and medications. Narrative text, which includes doctors' or nurses' notes, and then discharge summaries and referring letters. Adequate medical records enable you or somebody else to deconstruct the essential parts of a patient contact without reference to memory. They should therefore be comprehensive enough to allow a colleague to carry on from where you left off. And poor medical records are not only a major cause of injuries, they also make it difficult to defend a clinical negligence claim or Health Professionals Council of South Africa disciplinary inquiry. So poor note keeping is evidence of poor clinical practice. So what constitutes a good medical record? Firstly, it has to be comprehensive. It must be contemporaneous It must be comprehensible and accurate. It must be attributable and must be accessible. So let's look at these in a little more detail. When we say comprehensive, to be useful, the medical record should contain all the significant information that allows continuity of care. The Health Professionals Council specifies the following minimum information that should be included in the patient's clinical record. So there are personal or identifying particulars of the patient, biopsychological history of the patient, including allergies and any idiosyncrasies, the time, date, and place of every consult, the assessment of the patient's condition, the proposed clinical management of the patient, the medication and dosage prescribed, details of referrals to specialists, if any, the patient's reaction to treatment or medication, including adverse events, any test results, imaging results, or information on times that the patient is booked off from work and the relevant reason. So this also includes written proof of informed consent where applicable. So what do we mean by contemporaneous? For the sake of good continuity of care, patient records should be kept as up-to-date as possible, which means that information should be added to the patient's notes as soon as it becomes available. It is good practice to make a habit of noting information as it arises so that it is not lost if something happens to distract your attention. Example, could be an emergency, a phone call, or an interruption by a colleague. Late entries and addenda, if you're making an entry into a patient record after an event, do not backdate it. You should clearly mark it as a late entry using the date and time at which the entry was made. Any attempt to pass off a late entry as contemporaneous could, if discovered, attract serious criticism, including a finding of unprofessional conduct by the Health Professionals Council of South Africa or censure by the courts. So do not be tempted if you find yourself facing allegations of negligence to augment or alter the original contemporaneous notes. This not only amounts to unethical conduct, but will most certainly make your case difficult to defend. If you're looking at comprehensible and accurate, when making notes in a patient's record, a balance must be struck between brevity and comprehensibility. Generally speaking, the briefer the note, the more open to misinterpretation it will be. On the other hand, no one in a busy clinical setting has the time to either write or read lengthy prose, so your notes should be as precise and concise as you can make them. Avoid generalizations and speculation. Stick to the facts and your objective findings. If you are reporting hearsay, example, a relative's account, use quotation marks and identify the source. Avoid using abbreviations, as these may not necessarily be understood in the context of multidisciplinary care. It is an obvious point to make, but errors in medical records can have a devastating effect on patients. Something as simple as a misplaced decimal point, hearsay presented as a fact, or test results filed in the wrong patient record can be fatally misleading. If you're looking at the attributable feature, it's important that if anything is written in the patient record, it must be signed and you write your names in block capitals. You should also record the date and time. And then lastly, accessibility. A common cause of adverse events is the lack of access to critical information. This may be because the patient's records were not available at the time, or more commonly, because the needed information was lost in voluminous case notes. Given the amount of information contained in the average medical record, it is important not only to file information chronologically in the correct section of the case notes, but to extract and highlight any crucial information such as allergies, sickle cell status, special drug needs, etc., on the summary sheet or on the cover of the file. Record significant results of tests and investigations in the progress notes and pass on verbally and in writing any significant or critical information when handing over patient care to a colleague. So in summary, keeping good medical records is essential for continuity of care, especially when many clinicians are involved in a patient's care. Good record keeping is an integral part of good professional practice. Records should include sufficient detail for someone else to take over a patient's care seamlessly from where you left off. Records that ensure continuity of care will be adequate for evidential purposes in the event of a complaint, claim, or disciplinary action. So medical records should be clear, objective, contemporaneous, tamper-proof, and original. Most of you are currently keeping paper records, and based on what I've just described, keeping paper records can become onerous. It is for this reason that many organizations and individual practices are switching to electronic health records and starting to consider electronic health records moving forward. So why use an electronic health record? Firstly, you don't necessarily have to go about searching for files. It's easy to access an electronic health record. Getting the right information is very easy from within an electronic health record. There are various capabilities and functionalities which present information in various ways. And it also ensures compliance and mitigating risk and improving your relationship with funders, especially in our context in South Africa. Furthermore, improving medication management. Electronic health records have access to formularies which enable you to accurately prescribe drugs and prevent adverse drug events because you have access to allergies that the patient may have. Improving long-term care and reducing hospital readmissions. And then most importantly, as you're working through and collecting information within the electronic health record, this data is turning into information. So for those records or your old paper files that have many years of information, the electronic health record can enable you to have a singular view, a chronological timeline, graphical view of data that is coming, and simply enable you to have a better view of your patient from within an electronic application. So very briefly, just to summarize a study that was conducted in Australia on the use of electronic health records. These were some of the key benefits for individual staff members at a practice or an organization. Firstly, there was improved efficiency from a time perspective, improved ease of access to information. You can search for a record quickly and access it. More information led to a better understanding of patients' conditions and their issues, and the ability to basically deliver better care. And once again, you're able to assess staff performance and other issues like that much more effectively by using electronic health record systems. So what are the criteria for a good electronic health record solution? Let's look at these in a little more detail. So obviously, it's very important that the record must keep and abide by standards for good record keeping. I've described to you the SOAP methodology, the various methodologies, and based on your discipline, the electronic health record supports multiple ways of compliance to standards of good record keeping. Should help, provide, serve. It should be able to help you provide and serve and enable your workflow administration for patients and for staff. And it must adhere to certain architecture, communication, and security standards and requirements. These are just some of the criteria for good electronic health record. And it's important to ask the necessary questions, and I'll go through this a little later in the presentation. One of the key aspects of electronic health records is interoperability, and it's critical. So let me describe to you what we mean by interoperability. Functional interoperability is the ability of one system to be able to send information without loss of meaning to a second system, and for that second system to be able to use that information without loss of meaning. And this is what we call computable semantic interoperability, and it's vital in healthcare. I'd like to use a quote from the ex-Minister of Health that he made in 2014, Dr. Arun Motsoaledi, and he said that historically health information systems in South Africa have been characterized by fragmentation and lack of coordination, prevalence of manual systems, and lack of automation. And where automation existed, there was a lack of interoperability between different systems. And this is a massive problem in the South African health system. The Department of Health has developed what is called the Health Normative Standards Framework. And this framework represents the first steps towards a complete health enterprise architecture specification for South Africa. So when fully developed, this enterprise architecture will define how e-health solutions across all levels of healthcare in both the public and private health systems will interoperate with each other to support person-centric continuity of healthcare. So I'm glad that they've put together the Health Normative Standards Framework. This also includes Master Patient Index, or a health information exchange capability, which basically enables us to be able to identify patients across various facilities. So we have a long way to go in South Africa before this is fully in place, but at least the thinking is there, and that the electronic health records that you select for your practice today must at least ensure that there is the interoperability capability, so that in the future, when these systems are in place, communication or inter-system communication can effectively take place. There are various methods of ensuring interoperability in healthcare. HL7 is a set of international standards for the transfer of clinical and administrative data between software applications, and they have been in use for many, many years. The latest iteration is called HL7 FHIR, or Fast Healthcare Interoperability Resources, and it's a standard that describes data formats and elements and an application programming interface for exchanging electronic health records securely. And this is becoming the gold standard for ensuring that one system can talk to another system efficiently and effectively, and most importantly, securely. So let's look at selecting the right electronic health record for your organization. So once you've confirmed that the potential electronic health record meets, your record meets your requirements and complies with, international standards for architecture, security, and interoperability, you then need to ask yourselves the following questions. Firstly, what is my practice or my organization's short-term needs that this electronic, and can this electronic health record meet these needs? Okay. Secondly, can the electronic health record support the workflow that I have within my practice? And then lastly, will the electronic health create more care time for our staff rather than more administrative load? And this is a very important point I'd like to make. In the US, one of the concepts that have come out with the introduction of electronic health records over the last 10 or 15 years is a concept of physician burnout. And most of the physician burnout is attributable to the fact that the electronic health records that are in place make it or add a further administrative load to physicians. And you've got to be very careful when you look at an electronic health record. Is there too much of information that needs to be put in? Is there too many elements that are required to be added before you could save a record? Some things are necessary from to ensure that we have the minimum data sets, but it's absolutely vital that you look at various electronic health records and determine whether it's going to make your life easier or it's just going to add more administration to your daily workload. And a good vendor will be able to advise you on how best to overcome some of these issues without adding more administration. So let's look at the drivers and challenges and some of the suggestions for implementing an electronic health record. As I said, there are drivers. We look at drivers, barriers, and then how we go about the planning process for managing the change associated with implementing an electronic health record. So let's look at the drivers. Firstly, the needs of a patient are changing all the time. If you just look at South Africa, and it's not just unique to South Africa, it's international as well, the chronic disease burden is increasing every year. Patients' needs are changing. Patients want to be more involved in their care. Simply if we don't involve them, they'll look elsewhere. Patients are more informed than ever before. Not only is there the internet, there's artificial intelligence, tools such as ChatGPT and so on. So patients have a lot more access to information. And, this tech-savvy patient is wanting to adopt technology in all aspects of their life, including their health. So when you're treating them, obviously, the fact that you're using technology to treat them would make a difference, and they'd appreciate the fact that you are using technology in treating them. So this is one of the big drivers today, and many electronic health records come with supporting tools that enable patient engagement as well. Many of these are driven through funders, but that's for we could have that as a separate discussion at a later stage. But one of the key drivers for adopting electronic health records is meeting the ever-changing needs of patients. The other one is, computer hardware has become a lot cheaper. Processing power has increased. We have very, very powerful laptops that are available today with super processing power and solid state hard drives and the like. So, the hardware has become a lot faster and it's become a lot more stable as well. And it's no longer as costly as it used to be. Internet connectivity has become more accessible than ever before, and connection speeds have increased proportionally. So today, utilizing a cloud-based solution is really far better than using a local solution, but we will talk about the merits of those as well. Some of the barriers, and then look at the barrier and the potential solution as well. So firstly, one of the biggest issues is getting buy-in from staff and users. I've been involved in many electronic health record implementations, and by far the biggest problem is getting staff buy-in and adoption by staff. It is very easy for staff to switch back to paper after an electronic health record solution has been implemented, and you're going to be wasting a lot of money if you don't get this right. So how do we overcome this? It's simple. Involve staff from the very beginning and get them to help design the workflow, because if they are involved in making the decision and designing the workflow and ensuring that they're part of the entire process, the adoption is going to be a lot more smooth, and they certainly would be buying into the process a lot more effectively. The other one is technology factors, like making sure that the electronic health record can integrate with widely used systems and computer software for ease. So it's important that you carefully investigate this upfront to prevent late surprises and choose the electronic health record most likely to meet this need. Okay. Training. It, I can't emphasize this even more. You need to ensure that you make time available for yourself and your staff to be trained on how to use the electronic health record solution. One session is not going to be enough. It's absolutely vital that you engage with your vendor and that you plan multiple sessions, not just an initial session, but follow-up sessions as well. One way of ensuring that you can get this right and manage it more effectively is get your vendor to, after negotiations with your staff and yourself, to find a super user, somebody who's tech savvy within your practice, get them to be provided with a lot more information, a lot more training, get them to spend additional training sessions, and get them to become the super user within the organization so that that individual is the go-to person and that you don't necessarily have to be calling your vendor support center for advice on how to do things. There are many applications today, many electronic health records that have self-help tools within the application that help you navigate through the solution as well, and you should be looking at those as well. Security, absolutely vital. We are all aware of the issues around cybersecurity, about access to data and data leaks and so on. A good vendor will ensure that data is encrypted when stored and ask the relevant questions. If you're not sure, reach out to any of our staff at CGM and we'd be able to provide you with some guidelines on how you should be, or the types of questions you should be asking a typical electronic health record vendor. And cybersecurity and security is one of the important ones. Legal issues such as privacy and confidentiality of records, who should and could have access to the important data and information. Once again, this requires careful planning. Most systems come with role-based access, and you need to obviously, in your planning with your staff, determine who needs to have access to what part of the electronic health record. Some staff only need access to the demographic information, whereas other staff may require full access to the electronic health record. So planning around that in terms of who has access for specific roles within the practice is absolutely vital. And then you've got to also think future, because you can buy a system today and there may be upgrades that are required. Check with your vendor whether upgrades are free of charge or do you need to pay for these. And it's important to fully understand what you're buying, and that includes not just the software, it includes the hardware as well. So once again, it goes back to careful planning and ensuring that you have the necessary budgets over a period of time to ensure that over a long period of time, your solution is future-proof to carry you through a 5-year plan or a 10-year plan. And that's absolutely vital. So before starting implementation, careful planning is needed. Determine what you want to achieve as your short, medium, and long-term goals. Define the stages of implementation. And also agree on what type of application are you going to be using. Are you going to be working off a local server application? And there's actually nothing wrong with that, provided you have the necessary securities in place. Or using a cloud-based solution. So obviously, the dependencies there are on internet connectivity. But as I said, most facilities or most areas within South Africa today have very decent internet connectivity. So going for a cloud-based solution or a hosted solution is an easier decision than it was in the past. From a hardware perspective, it's important that, like I said, fiber is ideal. In fact, it should be essential. I don't think there's much ADSL solutions around anymore, but fiber is ideal. And ensure that when you're looking at fiber, ensure that you get a synchronous connection. So, they could sell you 100 megabits per second, but that could be 100 megabits download and the upload is only 20, for example. So try and find a synchronous upload and download, because you won't have issues with speed if you're using a cloud-based solution. I also want to, suggest that you use a wired network as opposed to Wi-Fi, because Wi-Fi has some issues from time to time, and a drop in connectivity to the router is not ideal when you're working on electronic health record. You've got to have printers, even though electronic health records enable you to start the journey to become paperless. Some documents need to be printed, sometimes for your patients, and so on. Scanning tools, so most printers have scanning capability as well. Often you want to scan some patient-related documents into the electronic health record, and that's important. So when it comes to hardware, choose a vendor that offers a complete solution. And then once again, ensure that you have redundancy plans in place, backups, and get your vendor to give you the assurance that even though it's a cloud-based solution, is it backed up? How is it backed up? Make sure that you understand the differences between the types of backup systems that are out there. One of the important things you should be asking your vendor is, if something were to go wrong, what is the turnaround time for me to continue working and having access to my records? And those are important questions that your hardware, or at least your vendor of the solution, should be able to answer. So let's look at how we can start the process. As I said, try and map your required workflow, step-by-step processes involved in delivery of your healthcare. Involve your staff in this process to ensure buy-in, and then use this opportunity to streamline your workflow as well. So the electronic health records, many of them out there, have a specific workflow that kind of enables you to customize it based on your requirements. But it's best that you look at how you deal with your patients today. What is the process? How do we onboard a patient? What information do we need to collect, and who's involved in that? What is the process to ensure that we collecting some basic medical information? Does the patient have to see a nurse for that first before seeing the doctor? Or is it fine that goes straight to the doctor, and if the nurse needs to be involved thereafter, that would be the process. So define and look at all of those things that happen within your practice, and ensure that everybody understands what these processes are and how they're going to be overlaid in the new electronic health record solution. So just continuing in terms of the process, as I said, determine the levels of complexity associated with each process. This would allow users to get accustomed with the basic functions and then progress to more complex ones, and then plan the phased introduction of these processes. So what we're trying to say over here is, when you map your process against what the electronic health record does, you'll find that there are functions within the electronic health record that are easy, and there are those that are possibly more complex. When I say more complex, meaning that you need to practice it a couple of times before you can use it effectively. Determine what those are, because you could start off by working through the easy to use functionality and move into the more complex functionality when you're more comfortable with the application. So just to give an example of this process, as I said, you could start off by simply working through basic clinical notes, and this could be free text under subjective symptoms, your objective findings, etc. You could then move into more specific condition-based forms or templates that could be set up for by your vendor. And when I say condition-specific, you could have a template for managing type 2 diabetes as an example, or managing a pediatric consultation. And your vendor should be able to offer you these. And if they can't, you know, they should be able to customize based on your specific requirements or how you do things currently, enable you to emulate that functionality in the electronic record. You know, the next step obviously is ensuring that you're able to start getting reports out of your system. And once you start understanding that, you can determine also how much more data you'd need to put in to get more reporting elements out as well. Integration is important. It's not necessarily the most important thing to do on day one. Most systems already come integrated with labs, so you don't need to worry about that at a later stage, and that's an easy integration. As I said, they are readily integrated. But I'm talking about integration with hardware. It could be a blood pressure monitor, it could be a Bluetooth device. Those bring in improvements and efficiencies within your workflow. So imagine, you know, your current method of taking blood pressure is manually. You then would need to type in the systolic over the diastolic. If you were using some sort of integration method of a Bluetooth cuff, that data would come into your electronic health record automatically. And those are things that you need to be chatting to your vendor upfront. What is the integration capabilities? Can this be done? I'm not probably going to do it now. I may want to do it in the future. Can you support it for me in the future? And as you start collecting more data, obviously the ability to start analyzing all of the information and move into analytics and trending what is happening with your patient base, you know, that then leads to having more detailed statistics and the ability to do research and so on. Electronic health records, a great journey to get onto. As I said, you can start basic, and as you start working towards mastery, you know, you can start utilizing the full breadth of the functionality within the electronic health record solution. So in conclusion, I'd like to, you know, just share with you the fact that the road to a paperless environment can be a long one. You know, with planning and forethought and commitment, it can be an enjoyable and enriching experience. If done properly, you'll wonder in years to come how you've ever managed without an electronic health record solution. And you know, to start the process, get advice from your colleagues, speak to practices that are already using electronic health records, get their insights and you know, what their failures were, what their difficulties were, and try and overcome those in your implementation of the solution. Finally, you know, many centers try and combine paper and electronic systems. You know, mixing systems and processes often creates poor data integrity and inconsistent workflows, which leads to compliance issues, inaccurate documentation, and health risks for the patient in practice. You know, it's important that if you're going to be doing this, do it properly or don't do it. It's important that you know, you can't still keep paper files and start working on electronic health record at the same time as well. In closing, I'd like to thank you for the opportunity once again to be speaking to you. We at CGM are an electronic health record vendor. We've implemented these solutions at many of our practices. And if you want more information, please speak to my colleagues. Our contact details are available, and you can reach out to us via EMC if you haven't got the contact details as well. Thank you, and I wish you a great afternoon. Thank you.